Hello, everybody, and welcome to another episode of ICS 2024 podcast series. I'm Shannon Wallace, and this is my series where I talk about all the workshops that we are going to be putting on at ICS 2024 in Madrid. And so today I am very lucky to have the chair of Workshop 10, which is Female Urogenital Fistula from Simple to Complex Scenario. And this workshop is actually a free workshop from the ICS Developing World Committee. So if you go on and register for ICS 2024, you can actually register for this workshop, and it is free for all ICS attendees. So this workshop will be on Wednesday, 23rd of October from 4 to 5:30 p.m. So the first day of the conference. And last year it was packed full of attendees. So I suggest if you're listening to this podcast and you're interested, you jump on and register as soon as possible. So today I am so excited to have the chair of this workshop, Professor Sherif Mourad, with me today. So thank you so much, Sherif, for joining me. So Dr. Mourad, or Professor Mourad, is a professor of urology at Ain Shams University in Cairo, Egypt, and he has a subspecialty in neurourology and urogynecology. So he is the perfect person to chair this workshop on urogenital fistula. So thank you, Sherif, for joining me today. And I just wanted you to kind of introduce yourself and then just tell me why you and your group decided to put on this workshop for the ICS membership.
Thank you, Shannon, for this nice introduction, and I'm happy to share this podcast with you today. My name is Sherif Mourad. As you mentioned, I'm professor of urology in Ain Shams University, Cairo, Egypt, and currently I am the Secretary General of the Egyptian Urological Association as well. And as you mentioned, I am the chair of the ICS Committee for Developing World. Actually, this workshop gained, became popular since a few years, and we noticed that there are a lot of interest for both urologists and gynecologists and nurses even to attend this workshop. We have a huge number of attendees last time in Toronto, and we are aiming that the participants can enlist the various etiological causes of female urogenital fistula in developed and underdeveloped countries as well, to describe the diagnostic steps of female urogenital fistula as well. We want an audience to plan for the treatment of simple and complex fistulas. Then we will discuss with them the surgical tips and tricks in the repair of the fistula, for surgical repair. And we put, like a short algorithm for the oral laparoscopy and robot-assisted techniques as well. So we are preparing for a long list of good talks for the audience to make sure that they have full review of this subject.
And I think this sounds great. I know, it's been put on for a couple of years, and it's always great that you and your team and your group submit another, to put on this workshop again at ICS, because it's always full with our ICS attendees. One, I think that fistulas, first of all, two fistulas are the same. So it's very challenging because every time you have a fistula, it's sort of like a different, almost like a different diagnosis, because you have to approach it a little bit differently. Like, it's not as straightforward as a very simple, I have prolapse and these are my options, or, I have BPH and these are my options. I think fistulas are challenging because they are usually so different, each of them. And so it's great to hear you describe how your team is going to be able to kind of lead us from, like, how do you diagnose this, and what are your options for treatment and for management, adding that video portion to it. So, in general, it sounds like you guys are going to be doing a little bit of a discussion on diagnosis and a little bit of discussion on surgical technique, and then some videos. Is that correct?
Yeah, videos and photos and some straight lecture. So, as you mentioned, fistula is not like a straightforward condition that you would go and make sure that you would find it what you are talking about. because every case is different. Every fistula could be different in the site, in the size, in the number, and in the code. What caused the fistula as well? Is it post-operative? Is it traumatic? Is it obstetric or post-irradiation? So it's very different, and the presence of fibrosis as well for the fistula is very crucial. And whether it's first time or second or after several attempts, so it's very different. So each case has its own, diagnostic parameters and the level of difficulty in the care. So that's why we are handling this in our workshop. So we'll start with the introduction, then talking about the etiology and the pathology of the urogenital fistula by Professor Cüneyd Zkürkçügil from Turkey. Then we'll talk about the classification by Wally Mahfouz from Egypt. Then I will introduce the common fistulas, zygovaginal and urogenital fistula myself. Then we'll go to the less common fistula like zyguterine and uretero-uterine by Dr. Cüneyd. And then we have some presentation and videos by Professor Sandip Prasan Vasavada from USA about the repair of complex zygovaginal and rectal fistula. His video, of course. Then I will talk about the approaches for the repair of the fistula and special types and the post-diversion fistula and the pouch fistula and post-irradiation by Riyad Al Mousa from Saudi Arabia. Then we'll talk about Sandip again will introduce the robotic single-port zygovaginal fistula repair, and then we'll make a conclusion and discussion with all the attendees. So I think we will cover most of the aspects of the problem.
Yes, it sounds like a very thorough program, and it sounds like you've really thought out, the different types of cases that you can present so that the audience members can hear all about the different types of fistulas and all about the different types of approaches. And it sounds like there's going to be some time at the end for a discussion and to hear from the panels, because I think that's another great opportunity for our ICS membership is that you have these panel of experts who've done, they're fistulas are quote unquote rare in that we don't necessarily do them all the time. And so when you have a panel who are more, who've had more experience with these surgical procedures, audience members can bring their questions and really hear from the experts about kind of the tips and tricks and things that you've learned along the way in your career. So that's, that sounds fantastic. So it's a lot to pack into an hour and a half. So they're definitely going to get a good 90 minutes worth of learning in that session.
And the most important is the part of the discussion, which makes a lot of interaction with the audience. It's really important for them.
Yes, I agree. I think people knowing if you're listening to this podcast and you're interested in this workshop, come with your questions. If you've had a complex case, I'm sure the panel and the speakers who you've just heard Sherif describe are all well-versed in this field, would be happy to answer any questions and bounce off ideas. And so Sherif, just in the last couple minutes here, it sounds like it's a very in-depth workshop with a lot of to cover. Who in our ICS audience, who of our ICS members do you think would really benefit from coming to this workshop?
We're sure that the urologists, of course, are very interested, the gynecologists and the urogynecologists. We also have some audience, the nurses, because we also need some tips and tricks about how to deal with the patient in the first part of the surgery. So this is very important for all these audience to come and discuss directly with us.
I think I agree with you. I think there's also the physician side, surgeon side, but there's also that post-operative care side and kind of all the conservative things that go into making sure these patients heal well. Because as you've probably heard this, and so have I, that the first fistula repair should hopefully always be the best one, because it can get harder and harder. So that post-operative recovery is really important. So that is great. Well, thank you so much for meet with me today and kind of describing this workshop. Any other questions or thoughts that you want to leave with our ICS membership before we sign off here today?
Yeah, it's all good, but thank you very much for the time. I just want to remind our members that we have our next Fistula workshop in December in Gambia, and they can apply online for if they are interested to attend live.
Oh, that's excellent. Great. So yes, that's an excellent opportunity for those of you listening. Go online, apply for that workshop in December in Gambia. That would be an excellent opportunity to also learn from these experts and do some hands-on training. So thank you so much for joining me today. Thank you, Sherif, for your time, and to all of our audience members, just as a reminder, so what we've been discussing is workshop 10, which is female urogenital fistula from simple to complex scenario. And this workshop is going to be on Wednesday, the 23rd of October, so the first day of the ICS conference from 4 to 5:30 p.m. You can register for ICS 2024 in Madrid, which is from October 23rd to October 25th. And when you register, this workshop is free, so you can sign up as soon as possible. And we are all excited to see you in Madrid, in Spain, in a few months from now.
Excellent. Thank you so much, Jen.